Hi everyone. I need to ask this question. Are you taking steroids? If you are, okay, listen to what I'm about to say. Let's go. If you are taking steroids through the mouth, that is per oral route, then be ready for the following possible side effects. You might have peptic ulcer disease. You might be bleeding through the gastrointestinal tract, and you can have inflammation of the stomach called gastritis. If you have peptic ulcer disease, if it's not appropriately taken care of, you can have intestinal perforation, and with that, you might now give up the ghost. If you're taking it intravenously or could still be per oral, with that, you can have high level of your white blood cells called leukocytosis. You might be prone to more infections because your immunity will be down. Your blood glucose level will shoot up. You can even be diagnosed with diabetes mellitus for the first time if you have genetic predisposition. There's possibility of increased glaucoma. Your heart rate may rise. There is possibility of mood changes. Okay, you could become euphoric and your blood pressure will rise. If you are prone or having genetic predisposition to hypertension and you are taking steroids, then you are writing letter to, or you are sending invitation to. You understand what I'm about to say? It's possible you have more acne and you increase in weight. If you have probable heart failure symptoms, then it will become more clearer because it's going to worsen the heart failure symptoms because it will retain fluid. The other time I say you could become euphoric, the same time you could become depressed. And I've talked about possible infections because of decreased immunity. And that's what they call hypothalamic pituitary adrenal axis. So the function of the adrenal gland to control fluid, steroids, blood pressure, and everything, electrolyte, that is regulated by the adrenal gland on the kidney will become dysfunctional when you are on exogenous steroids. There's possibility of increased hair growth and facial erythema, particularly in the younger age group that are taking steroids. There's possibility of vascular necrosis. And when it affects the joints, particularly the hip joint, you can be limping. Myopathy, insomnia is possible, and mania, psychosis. So a lot of people having psychiatric problems and have been diagnosed and in hospital right now is not only because of cocaine or amphetamine, it could be as a result of steroids usage. Akathisia or Exophthalmos could also be present. As possibility of Cushing's syndrome, cataract, skin tanning, particularly if you're applying on the skin topically for a long period of time, euphoria or ecchymosis, pseudotumor cerebri, steatohepatitis, growth impairment in children. I want to lay emphasis on that. Growth impairment in children. Unfortunately, some children are on certain type of corticosteroids because of the medical problems they have. Like those who have renal problem, rheumatoid problem, or those who have asthma and they are on steroids for a long period of time, don't be fooled, it can affect their growth. Cataract is not expected in a younger age group, but it's possible if they are on steroids. So if you're on steroid, if it's not prescribed by your doctor, then be ready for all these area of troubles. But if it's been prescribed by your doctor will tell you these possible side effects, and they're going to tail off your steroids, and I'm going to take it off suddenly, because if it is taken off suddenly, you're going to have crisis. You can have a dystonia crisis, because what we call hypothalamic pituitary adrenal axis will shut down when you take the exogenous steroid off. I don't need to go into these details. Your doctor will guide you. Okay, kindly subscribe to my channel so that you can be getting these publications immediately they are released. I appreciate it. Thank you.